Good morning, Lyndon. Thanks for agreeing to meet with us and let me ask you some questions about Autism Calgary. The first question that I wanted to ask you today is, can you tell us a little bit about Autism Calgary and how you support children with medical complexity and their families?
Uh, yeah, I can. Autism Calgary is a peer network. I would tell a new family, refer to us, think of us as the community association of other parents and autistic individuals with that lifelong experience on the spectrum. Um, you wouldn't necessarily think of Autism Calgary, therefore, as an organization providing service to complex case care. But the reality is that families with a crisis in complex care or a transition in their life often feel they have very little to turn to or no services to turn to. So we're actually the first place they call. They contact our support, we have support groups, we have family support workers. We frame everything we do through the shared peer-to-peer experience and refer people on to professional services where they exist. But we're often the first people to contact. They say, I'm in this desperate situation, what can we do? So we can link people to other families that have been in complex situations. We can send them to resource professionals. When there is no service at the end of the day, we're left trying to do something, scrambling to help people.
Mhm,
So we actually play a very pivotal role.
mhm. Absolutely. So, I would imagine that there are some challenges and barriers to offering this support for these families. So, can you talk to us a bit about some of those challenges and barriers and how you might address them, or what other resources or partnerships are helping you to better serve these families?
Um, now I have to pause
It's a
on
big
that one.
question. Yeah.
That's a big question.
Yeah.
So what do we do to deal with it?
Well, I guess, or first, what are some of those challenges or barriers?
Well, what we've seen an evolution that has created an increase of families in complex care coming to us. I mean, social media has sort of naturally created organic community networks between families. So we are seeing an increasing number of people in a greater crisis. How we've tried to step up to the plate has been through some foundation and grant applications to help us better understand issues around complex case care, maybe understanding mental health and suicide risk, or people introducing issues around family violence, which on the autism spectrum, what we actually discovered in some of our partnerships within the Family Violence Network is, well, that realm of the world has advanced quite well. Where it hasn't is when the violence is with someone who might be a child or adult that's profoundly disabled and is the one uh, resulting in the violence in the home. So we've had to use some grant initiatives to do some research on the topics, learn about things like anger rumination, apply to have extra books in our library, look for guest speakers and hold some workshops for our families. They're really very small steps. I kind of feel sometimes like we're taking a stab in the dark, but partnerships, even like being part of this conference, are really key, because I think as we from the lived experience talk about the challenges and maybe how the community's pulling together, we
Mhm.
can raise some red flags on people that are coming from that clinician perspective or the research perspective. So I think it's a bit ill-defined, but forming itself.
Mhm. Perfect. Thank you. The next question is a timely one that we're all curious about in all of our areas. So, the COVID-19 pandemic, I'm sure, has changed a bit the way that you are able to support some of these families. So, can you tell us a bit about how Autism Calgary has adapted during the COVID-19 pandemic?
Well, like many charities or not-for-profit community groups, at the beginning we kind of worried about our total survival. Um, but as a mature parent network, with a mature forming charity, we were quite nimble in applying for some grant opportunities, and we had some really good provincial partnerships. So through COVID, we actually have an emergency response and recovery initiative that is done in partnership with Autism Society of Alberta, Autism Edmonton, Autism Society of the Regional Municipality of Wood Buffalo, Peace Autism Society, and Chinook Autism Society. And we are coordinating a larger team of parents and advocate peer mentors, calling all of our members, some of them in more complex crisis right now. We're learning about resources they didn't know before. So we've been nimble, and I'm quite kind of proud of what we've done under that. Coinciding to that, other work we've done through our provincial collaborative and national collaboratives has been leading the formation under Autism Alberta of what we call Autism Alberta's Alliance. And we held conferences pre-pandemic, 3 of them, pulling together clinicians, government, researchers, establishing sort of committees and working groups to try and build a provincial autism strategy. There's been some national efforts through CASDA, Canadian Autism Spectrum Disorder Alliance, that sort of there later evolved to work with the Public Health Agency of Canada. That's working on a national autism strategy. What's kind of exciting now through our progress under that and now into COVID, now that we've adjusted to our response and recovery initiative for our families, we have a very active planning committee looking at building the framework of a provincial autism strategy. And what's kind of critical in that is a national autism strategy will sort of be very valuable in supporting Canadians universally and ideas for how provinces can evolve. But it's at the provincial level that health, education, and community and social services are run and operated. This has given us more networks to the provincial government, and we have a fairly positive working relationship with people in a number of the ministries. And under, it does relate under COVID. We've helped provide guidance to Alberta Health Services when they we're building the framework for ethical protocols of emergency care, life-giving care under COVID. And we've given guidance and support on the decisions they've made about the vaccine prioritization. Sometimes we've had to be a little louder than others, but it's been quite a collaborative and positive relationship with government. So,
great, thank you. The next question is a bit around assessing and or evaluating. So, is there a way that either formally or informally that you assess the support that you're providing to be able to adapt and plan for the future?
Again, it's certainly, it'll be both formally and informally, but not necessarily clinically as another group would do, because we are very much a peer network. We are involved in some partnerships with researchers that are looking at peer networking opportunities and protocols and supporting through focus groups. So there is some activity we're on there that I think that has sort of the future way of informing what we evolve and how we evolve. But I think the more immediate feedback is really in identifying if families leave and report that they're in a better position than when they first contacted us. And again, we did sort of, I think in prior conversations, I've talked about how it can be very challenging when we're not necessarily registered health professionals providing the service. Where some of the people on our team happen to be, but that's more coincidental. It's our team is built more of people with a life experience. Finding that ethical boundary on knowing that we're providing someone that kind of support that is appropriate for a peer network, but still making sure that they can get the professional resources to deal with mental health or the work that a social worker might give in case management is really critical. A long-winded way of talking about evaluation, but again, it's tough. We end up doing work that I think probably should be done by a social worker dealing with case management background and psychology. But how does a group of parents turn another parent away in a situation when those resources aren't there? So it really is about that individual feedback from that family and maybe collective feedback that we learn from focus groups when we bring families in to talk about researchers, kind of looking at community dynamics and peer networks.
The second part to that question was a kind of around the future and are there any future plans to expand any services. And I know we haven't had a chance much to talk specifically about the library, but I know the library is something that you have worked really hard on and created a wonderful resource for parents. So, kind of thinking along those lines, are there upcoming things, exciting things for the future with Autism Calgary that you want to talk about?
Well, I think there's a lot of, we sort of mentioned Autism Alberta's Alliance. We mentioned sort of collaboration provincially with other autism societies. One thing I didn't also mention in that regard, and probably really helps to answer that question, Autism Calgary happens to be in a collaborative application where we're in a partnership network. We're supporting the Aid Canada project, which is a national website resource for autism and intellectual disabilities. Autism Calgary is the lead partner, together working with Cine Family Foundation, Autism Services Alberta, Autism Society of Regional Municipality of Wood Buffalo, and Autism Edmonton. Collectively, we run what's called the Prairie Hub. And part of that project is putting asset mapping to put programmings on this national hub website, but also build resources. So we are getting some resource grants that are building some informational pieces that will be part of that national whole. For example, through 2020, we contracted adult autistics to write content for that on important issues like employment and housing from an autistic perspective. And there's some videos, some guidebooks and tip sheets that are being published right now. We have a new project initiatives under Aid Canada to build some quick tip sheets on issues of taxes, sort of common concerns that parents call the peer network for. Can I claim this on my tax? How do I get the, how does the disability tax credit work? Some of that information is up there, but we're building some new resources. So a lot of partnership is happening within the autism community and autism communities regionally, provincially, and nationally.
Very exciting. That was the last question that I had prepared for us. So I just wanted to, again, thank you very much for letting us capture this information and for sharing it with our conference delegates. So thank you, Lyndon.
Thank you.